what are some of the barriers and facilitators to shared decision making? And then what are some of the tools that healthcare providers, physicians in particular, need to engage in shared decision making with their patients?
Yeah, I think first and foremost, I would have to start with how we pay for healthcare. Trust me, I'm a surgeon, and so and I think we benefit greatly from the fact that we value procedural based care much more than we value like things that our internist and primary care colleagues do, right? And I think that the focus that we have currently on trying to get back to preventative health, preventative medicine, focus on primary care, and a focus on trying to integrate public health into more of the clinical aspects of what we do, I think are all like pathways to get there. But in order to get there, we have to change the way we pay for healthcare. Like as long as we're paying incrementally for transactions, like I think that providers are pushed to do more and spend less time with patients. So when you move to a value-based care model where folks are paying globally, or what some would call capitated, or pay in ways that aren't connected to the specific interventions that I provide, but more focusing on what is the right thing to do, that aligns very well with shared decision making, right? Because at the end of the day, oftentimes the decision may be to do nothing, like, and still the clinician needs to be compensated when nothing is done, right? Because they've had a conversation with the patient. So I think that that's a big part of it. I think the other is what I alluded to earlier. I think that we need to rethink how we structure places. I mean, I think that there's really good work in trying to rethink like how healthcare facilities should be structured, how clinics should be structured, such that we can spend more time with patients in ways that allow us to interact with them, like to understand what their preferences are. Like the rapid turnover of not like having patients and their providers and their care team all in the same place is a problem. Like, and I think that the more that we can co-locate multiple aspects of a patient's care team into the clinical experience, like the more we can establish these conversations, not just with the patient, but some with whether there are other caregivers. So that when we're talking about shared decision making, it's not just between me and the patient, it's me and the patient and maybe their care manager, and maybe their home health aide, maybe it's their mental health professional, so that we're actually making these decisions in a multidisciplinary way, like working together.